Well, and I'm Gil, and I am, way I thought we'd do this, I'm going to tell you a little bit about my story, what brought me here to VG, a little bit about what I've seen in terms of development of the organization, and then I'd like to hear about what brought you guys here, and a little bit about your story, so just be kind of thinking about that. But so I've been at Virginia Garcia about almost 29 years now. So I can't believe it, but time flies by at this place. But I originally from the East Coast, from the DC area, and I grew up in a home where my mother's French, my father is from Mexican background. So we had a lot of interesting kind of a hodgepodge of languages in the home. And after college in Maryland, I went to New York City to work in a program that worked with street kids in New York City, a place called Covenant House, and which was a real eye-opener for me, and working with kids from the inner city and also kids who came from all different states who wanted to make it big in New York City, but there was a lot of issues. This is in the mid-'80s, it's when the crack epidemic was really full and high, and it was really exposure with a lot of displacement of kids coming from families all over the New York City area, and so it was a real eye-opener for me. And then I did a couple of years working in Guatemala in Central America, which was also very very interesting, and working for an international program down there that worked with kids again in development and in Guatemala City. So when I got back from the States, I did some work more on the policy level of things back in DC, working with Central American issues, but more in the academic and congressional level with policy. And before I moved out to Oregon to start a master's program at Lewis and Clark, and I learned about Virginia Garcia and started here while I was going to graduate school. And it was quite a different organization back then, quite a bit smaller. We had just the one site in Cornelius, and then we would go down to McMinnville like once a month to provide services off of a mobile clinic, but it was really a very grassroots type organization, which is what appealed to me about it, is I wanted to come in and still work with the community, working in issues of access and community health. And just over the years have worked to help the organization grow, responding to the changing need, and the demand for services in the community. So staying focused on Washington and Yamhill counties, that's what our board, which is made up of community members and patients of the health center, have really stayed focused to wanting to ensure that we provide access and services within Washington and Yamhill counties. So we've expanded that way. When I first started, we served about 7,000 patients, and today we're a little over 46,000 patients that we serve across Washington and Yamhill counties. And we've also, in the process of expanding access, have also been able to expand the model of care to incorporate dental and pharmacy services and behavioral health and then our outreach services. So outreach is always been a component of the work that we do at Virginia Garcia, going out to the migrant camps and the vineyards and nurseries, and so that piece has pretty much stayed steady, you know, within Virginia Garcia, and so the services have developed around this concept of a patient-centered primary care home, you know, where we have a team approach to care, and also that we've been trying to incorporate more preventative services, you know, within a primary care clinic. So unlike a typical doctor's office, we have tried to develop, you know, incorporate things like a teaching kitchen and, you know, wellness activities where we're trying to engage our patients in their own health, and particularly those with chronic conditions. You know, it's really important that they are the ones who are motivated and engaged in their health care, because we can't do it, you know, on our end. We see them once in a while, but they have to take charge of their own health. So that's a little bit about me and my story. And so what about you guys? What brings you to VG? Anybody. We don't have to go in a line.